Hello and welcome. Amy described a case of a child that was suffering from autism and the homeopathic treatment, and I thought I'd elaborate on the treatment of autism using homeopathic medicines. I guess my history with this diagnosis was starting to treat people in the late 80s and describing the treatment of homeopathy by the early 90s, and I'd say for the longest time I was seeing just my practice was just full of patients with this diagnosis, and I thought I'd like to sort of describe the reality behind the situation, which I think is still somewhat not as clear as it could be. So if you were to take all the patients that are seen with this diagnosis that are treated homeopathically, just so you have a sense of what is likely to happen. And if you had the y-axis number of individuals and the x-axis the benefit that they get from homeopathic treatment, I'd say a kind of a skewed bell curve is what you should expect, with the small minority actually losing the diagnosis. In other words, they were diagnosed with autism and they no longer fit that diagnostic criteria. I think Amy described such a patient, but this is not to say that everybody you see is going to fit that criteria or that outcome. There's a set number of kids and individuals that have the diagnosis of autism, will treat them, and not much happens with them. They still have the same amount of autism, they still fit the same criteria, they still fit the same severity. And it's not clear why this group doesn't move that much. Luckily, it's a small percent of the overall number, but it does exist. And interestingly enough, this is the same group that seems to have a great amount of difficulty trying to get any sort of benefit. But I'd say the vast majority of individuals that we see will get a nice improvement from our treatment, by which I mean their severity within the diagnostic criteria is diminished, sometimes greatly. The symptoms associated with the core symptoms of the core features of autism really improve, and in general, we see a nice movement of the majority of individuals moving towards the right on this bell curve. And I say this because a lot of times you read in the journals, or you hear somebody talk about this in a lecture somewhere, where it almost seems like everybody that sees a homeopath is going to get cured with from their autism. And in a sense, this is both not useful for the parents because it doesn't actually fit the reality, but it also is not useful for the child because a lot of times what winds up happening is as the child is improving, sometimes the homeopath, thinking that they're doing something correctly, winds up overprescribing, changing remedies, repeating the remedies too often. Whereas the reality of the situation, and this is in a way one of the nice things about the course that we offer, which is that we really talk from our experience and that we've seen a lot of cases of whatever it is that we're talking about. And I think a very clear thing you can tell a very clear description you can tell your patients and their families is, what should I expect with my child or my sibling that has autism? What should I expect with homeopathic treatment? I think the fair thing to say is just exactly this. The vast majority of people will have improvement. Sometimes it's a small improvement, sometimes it's a sizable, very clear, beautiful improvement, and rarely we'll see kids and people that actually lose their diagnosis. So I think this is a very important piece, and in a way it also exemplifies what's sort of interesting and unique and valuable in the course that we teach, which is that we really describe very well the realities on the ground. As an aside, I'd like to talk about how it is that we often get to this, because historically what would happen is when a patient would come to a homeopath, and the homeopath would take the case of somebody that had this sort of more severe neurological disorder, a lot of times what they would say is, well, we can help the patient in general, but we can't really fix this disorder. We can't really modify this disorder in any sort of way. And the reason for this really touches on this map of hierarchy that Amy described the last time, which is that they would prescribe for the remedy that was sort of in the first quadrant, whereas the patient needed a remedy that was in the fourth quadrant that really fit the neurological symptoms. And so the patient would have, let's say they had colds and flus and autism and of a certain severity, then they would take this first quadrant inappropriate remedy, and they would lose their colds and flus, but the autism would be really unchanged. Whereas by using the map of hierarchy and targeting the most severe symptoms first, we can actually modify the neurological symptoms. And this is easy to describe and to gauge by using any of the standardized instruments and measures of severity in autism. And you can see the severity just dropping. You can see children that couldn't speak that are speaking, people that had one-word sentences have increasingly complex sentences. And this is just the core symptoms, the repetitive behaviors and so on. But aside from that, there's all the other symptoms that come with it, the potential violence and the potential anxiety and fears, and all of it just seems to really be able to be modified to be less severe, and even sometimes completely gone. I think this is a fairly good example of the world of autism. It's a very good example of why this concept of the map of hierarchy is important in trying to target the right remedy for the right individual at the right time. Amy, maybe you'd like to talk about the next...
Yes, thanks, Paul. We're going to wrap up the countdown next week, which will be week 7. And what we feel, the gift that we'd like to kind of wrap up for you, put a little ribbon on it, is a gift of the materia medica of one remedy in particular. One of the things that I think really makes the NESH class stand out, at least is what we hear from our students, is that when we describe the homeopathic remedies in very minute detail, we start out with the cycle of the remedy in the broadest sense of the term, and then we work with fleshing that out and creating the whole cycle of the remedy for you, and how it manifests in children and teenagers and adults, and what kind of illnesses somebody who needs this particular remedy would come in with, and how we would find them in the office. And so Paul next time will describe the materia medica of a remedy that is not as prescribed as it might be. It's a remedy which is called gallic acid. It's Gallic, gallic acid. And you have a homework assignment. What we'd like you to do between now and our next meeting is we'd like you to go into a materia medica. If you don't have one at home, you can look online and read about the remedy. There's not a lot written about it because it's not a remedy that's been used very often. But in our describing the materia medica, when we teach materia medica, part of what we are trying to do is to model what it is we're supposed to pay attention to when we're learning the remedy. It's the exact same skill that we kind of alter when we're taking the case from the patient to try to determine what is it that we should be paying attention to with the patient. We do the same thing when we're teaching and studying together the remedies. So if you come to our next lecture having read a little bit about the remedy and giving yourself a little bit of background about the remedy, and just, you can thumb through or you can scroll through on the internet, read about gallic acid, and then we will talk about it. One of the most incredible things about learning materia medica is that if you understand a homeopathic remedy deeply in all of its manifestations, It's as if you are better understanding the way some people live in this world. And that's a gift of homeopathy. Even if you never use a homeopathic remedy, understanding the way that people function in this world and how stressors in their lives can impact them, how the physical body can be impacted by stressors, how the psycho-emotional part of the person can be impacted. The homeopathic remedies give us a window into different ways of being in the world. And it's very fun to study materia medica. It's very interesting. And of course, when we're teaching, we are always trying to differentiate among remedies that are close and similar and share certain features, because some remedies have overlapping features. Maybe they share one segment as a language that we would use. And so as a provider, you need to be able to understand among those similar or close remedies. And gallic acid has some friends nearby that if you're thinking about gallic acid, you should also be thinking about X, Y, Z. So next time that we meet, Paul will discuss gallic acid, and we'll leave it there, and look forward to seeing you again soon.